COVID-19 numbers are spiking at correctional institutions in Thunder Bay. Here's Judith Monteith, Farrell. It's James with NetNewsLedger. Joining us by Zoom, because it's COVID-19 times, is Judith Monteith, Farrell, the MPP for Thunder Bay Atikokan. Judith, welcome.
Hi, James. It's so nice to see you, even if it is virtually.
We're all becoming virtual people. We're talking on Zoom for hours a day. We're watching Netflix for hours a day. And we have some real problems, which is what I wanted to reach out to you and talk about. Today, the Thunder Bay District Health Unit outlined that there's over 50 cases of COVID in the Thunder Bay District Jail and the Thunder Bay Correctional Center. There's a crisis in the jails in our city as big as the crisis in long-term care across Ontario. What needs to happen?
Well, it's interesting. When I heard that the outbreak had started, I was very concerned because as someone who has toured that jail several times, I know it is impossible to have protocols in place in that facility that would be healthy or would follow any kind of public health guidelines. And so I know about the overcrowding, and I heard that it is overcapacity. It is a remand center, so there's people coming and going from that facility. So it is, and we hear now that, not only inmates, but also correctional officers and potentially their families, who knows, are also being infected. So those numbers are startling, but not surprising.
Is the Premier doing enough?
I don't believe that the planning that, in the first wave, it was understandable. We were dealing with something that we really didn't have our heads around. But we knew the second wave was coming. Every epidemiologist told us. And we know we have these settings like long-term care, like congregate settings of habitation, and like prisons, where we need to put things in place. So we could have done that work during the summer, and that didn't take place, and I'm upset about that.
The issue seems to be one of almost quiet. I know on the federal level, the Conservative leader talked about anger at the fact that prisoners were going to get a vaccine, but the reality is the state has taken a responsibility for the people who they are incarcerating. And the guards and the staff end up affected, and that's what we're starting to see right now.
Yes.
Looking at issues here in the riding, what are you hearing? What are you finding going on here in Thunder Bay Atikokan?
I think overall people are tired of the pandemic, as many are, right? As we all are. And the kinds of issues are around concern with long-term care. That was when we had the huge outbreaks. People panic and people are afraid. And we know that the bad situations that happen at long-term care really were there before a pandemic. And now when those folks are sick, we see, the cases spread, the infections spread. We hear from people who are very confused about the messaging around the lockdown. It's just stay home, but if you're this, you can operate, or if you do this industry, you can operate, or if you're this industry, you have to go to work. So there's all the mixed messaging around just stay home, and yet, all these other folks are out and about and having to carry on. And so that is confusing for people. And people are also looking to have some normalcy in their life. Like they want to go skiing. They want to be able to take a walk. We have people calling our office asking can I visit my mother? She lives alone. Is that okay? Am I going to get fined? A lot of confusion.
It seemed to take from the time that the Premier said these numbers are going to have you fall out of your chair, which he told us on a Friday, and it took till Tuesday before they gave us the numbers. And then it was 2 more days before they put in the lockdown requirements. It seemed really slow.
the whole process around this pandemic has lacked transparency. He's been reluctant for public inquiries around long-term care. He's been reluctant to really tell us even who's at the command table. We had to pry. There were all sorts of ways where there's a lack of transparency about what's going on, and that adds to people's apprehension. I think what we need is not drama. We don't need someone coming forward and saying, oh, I'm going to make an announcement in 3 days or 4 days or 5 days, and it's going to be really bad. What we need is very clear and comforting messaging and hope that, going forward. So even the information around the vaccinations, we're going to get them, we're not going to get them, who's going to get them. People really like when the instruction is clear. And in some ways, you can't predict everything that's going to go on, but I think it's really added to the confusion.
Judith, do you have a message for the people in the riding for Thunder Bay Atikokan?
Well, I think, first of all, I want to say congratulations, because people have taken this very seriously and have done a lot of hard work, and people have pitched in, helped neighbors, done extraordinary work about keeping people safe. I think of the public health lab people who have not had a day off and been working, 24 hours. I mean, those folks, the testers, the frontline staff, the people that are brave enough to go out and give us the services that we need. They have families too. They're afraid too, but they are out there doing what they have to do. And so I really have to congratulate the citizens on how they've dealt with this. And, let's hope that we can do the messaging better, and let's hope we can get through this together.
Judith, thank you for taking the time. Let's keep the conversation going.
Okay, thanks, James. And thanks for your interest, and stay safe, you and your family.
Always. To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.